Yeah, all like we got experience,
You're doing a comprehensive meeting. I love working with it. So far.
They love
All right, let's get rolling here. So this slide right here that I'm showing you is what we call an Align. It's our digital platform. So all big companies, Amazon, Netflix, everybody has a digital platform. If you're a corporation, you have a digital platform. What I mean by a digital platform is that it enhances your and my experience as a doctor, and it makes us more easily able to use the system properly and effectively in a timely fashion. So the true digital platform usage for doctors like myself that have iTero scanners is it looks like this. So we would start out with an iTero scan, and you guys are doing impressions. But you would basically, in the digital platform, you would start out with an iTero scan, and you would use the Invisalign photo uploader, which all of your staff next door is learning how to do. And that's a way to really simply take pictures for Invisalign and have them go right into your Invisalign doctor site. Once you have your scan and your photo uploaded, you submit your prescription, then it goes to Align, and they apply all the algorithms and the artificial intelligence with 7 million cases to create what we call the ClinCheck, which means an Invisalign treatment plan. So an orthodontic treatment plan in the world of Invisalign is called a ClinCheck. Okay? It's not called an ortho treatment plan, we call it a ClinCheck. So pictures, scan, prescription goes in, it develops a ClinCheck for you, and it comes back to you, and then you evaluate it and approve it. I'm going to show you with Invisalign Go how easy that is. And then once you approve it, it goes to our 3D printing factory in Juarez, Mexico. We have a couple around the world now, but your ClinCheck order will go to our 3D printing factory, which is the largest 3D printing company in the world. And how many aligners do we 3D print a day?
300,000.
2 million?
What was it?
Is it more than 2 million?
500, 500,000. So we 3D print 500,000 aligners a day. That's an insane amount.
When you say we, the company.
The company.
Yeah, Align, because I work for Align Technology.
He does it himself.
I
You
say
should say
Since
I.
they're
You should say
in
I.
my backyard, yeah. But we make 500,000 of these things a year, right? And it's 3D printed, so this is all digital, right? So digital scan, digital software to the treatment ClinCheck, to approval, to digital manufacturing, and then digital labs. That's where we have the people in Costa Rica that are developing your ClinCheck treatment plans. And then also in the platform is education, meaning like people like me will come and teach you Invisalign. And then education, if you go to your doctor site, you log into your Invisalign doctor site, you can go to our academy. We've got hundreds and hundreds of courses on there that you can take, ranging from 10 minutes to 2 hours. You've probably taken a lot of them. You want to take those courses. That's how you learn different tricks and techniques, because I can't sit up here and talk for 50 hours and teach you every little technique I know. But on the academy, you can be lying in bed for 20 minutes, look at a video and learn how to treat an anterior open bite, or learn how to put on attachments, or learn how to do IPR, or learn how to treat a deep bite, or learn how to do a cross bite, or learn how to do an AP correction. Everything you want to know is on the academy, and it's free, and you get CE, free CE. You can go on there and get like 26 units of CE in about 3 days, just by watching some videos. So it's free. So this is the digital platform that Align Technology uses to support docs like you and I to make doing Invisalign a lot easier and a lot more effective and accurate. I want to talk about this next slide because when you guys are in your offices, and especially you hygienists, and you start talking about Invisalign, or if a patient asks you about Invisalign, I want you to be able to have an intelligent conversation on what Invisalign is and what are the advantages of Invisalign clear aligner therapy over wires and brackets. So let's do a little family feud game here. And the next slide has the answer, so I'm not going to go to it. So who can give me one reason why aligner therapy will be better than wires and brackets?
More convenient.
Because they'll lose them.
Okay, one at a time. Now this is family feud. Okay, go ahead.
Convenience.
Convenience is the right answer. What's more convenient about it?
You can take them out whenever you want, and you're not coming in as often.
Exactly. So if you're a soccer mom and your teenager's got crowded teeth and you want to do Invisalign, you can tell her confidently that way less appointments with Invisalign therapy, way less time taking him out of school or soccer practice or you leaving work early, because we don't have to see Johnny every 4 weeks like we do with braces. We can see him maybe every 8 weeks or 10 weeks or 12 weeks, whatever you're comfortable with on your recall. So convenience is an answer. What's another one?
Less decalcification around brackets.
Boom, that's a big one. So we don't get any decalcification with the liners. Good answer. That's 500 points right there. Go ahead.
Your brackets won't pop off.
Exactly, that's another big one. So no emergency appointments, like Dr. Pope does not have to go in on Sunday because of all those wires and bracket cases he does and put wires and brackets back on when he'd rather be watching the 49ers beat the Rams.
Cleanliness.
Cleanliness, that's another right answer. Why is it more cleanly?
It's easier
Clean-
to clean
clean-
because you're taking
Why is it
them
easy?
out.
Yeah, you,
Floss like normal, brush like normal.
exactly. So hygienists love it because Invisalign patients have actually better perio. And just so you know, one thing, what I do is I increase my perio recall one more time if my patient's in Invisalign. So I'll have my hygienist do 1 extra cleaning in the year. So it's 4-month recall instead of 6 for a normal patient, right? Because you want to make sure that tissue stays really healthy because it affects orthodontic movement. If you've got an inflammation and perio going on and you're trying to move teeth, it's going to hinder your movement. So you want to make sure if you've got hygienists that you up your patient's recall. If your doctor's got them in aligners, you want to see them one more time, increase your frequency, right? And you tell the patient that when you're doing the consultation, this is part of the treatment. Like you're going to be in aligners for probably 7 or 8 months. I want to make sure we don't just do one cleaning for the next 8 months. We're going to, just throw in one more cleaning. You might have to pay an extra $70 because insurance doesn't cover it, but it'll enhance your ortho movement. What's another one?
Looks better on the first date.
Looks better on the first date. So cosmetics, aesthetics. Looks better on the last date too. So yeah, that's true. So aesthetics, cosmetics, like the appearance, like teenage girls do not want braces, nor do boys. So you have an opportunity to make their experience be more cosmetic and aesthetic. What else?
Braces hurt.
Pain. That's a big one, right? So does Invisalign hurt?
Yeah, it's uncomfortable.
Does it hurt
Or
bad?
straight. Like when you
Like
first
level
start,
what? Like out of a scale of 10, what's the Invisalign pain?
Not as much as I did brackets 3 years ago. It's not as much as brackets.
Not nearly as much as brackets. And I can speak from experience since I've done both. So the level of pain with Invisalign is like level 2 pain. If you're uncrowding a lot of lower front teeth and they go to bite on a carrot or French bread, it'll be tender. But if it's just regular expansion, uprighting type movement, it barely hurts at all. I don't get people coming into my practices complaining about pain ever.
And is it usually located just like the first week or two, or right when they
It's
start?
usually when you switch aligners and it's doing the movement, it's that first like 24 or 48 hours.
Right.
Once you put a new aligner in, you get to the 3rd or 4th day, right? Do you get patients complaining about pain?
With brackets and wires.
No, with Invisalign.
No.
So that's a clear advantage, right? What else? Anything else?
Predictability.
Predictability? Yeah, I think that's true because we're digitally programmed, right?
Yeah.
So remember, like if you're doing wires and brackets and you bend a wire and Jimmy comes back 3 weeks later and the tooth moves opposite of what you wanted to do, you got to rebend the wire and hope to catch back up on track where you were before, right, Doc?
I just don't bend it where you want it to go. I don't run into that very much, to be honest with you, but.
The patient.
But the reality is you're accurate because with Invisalign, right, the software designs where the teeth go. And when you do Invisalign Go, if they wear the aligners, every time they switch, that's where the teeth are going. So it's super predictable and quick, right? What about speed?
Only 3 hours for the whole treatment.
The whole treatment, 3 hours?
Well, you said it was like total over the 4 appointments.
Oh, you mean chair time?
Oh, no. Oh, yeah, no. Yeah, that's an advantage, doc. But I'm speaking more for the patient. But that is a clear advantage for the doctor. Yeah, less chair time.
Well, it's less
And
than
less
that.
staff too, right? Like if you're an orthodontist doing wires or brackets, you're in the chair way more appointments, and you need way more staff
Yeah.
and supplies. Remember all those answers. Wires and brackets, the dark ages. What else? Yeah.
And my kids hated the way if the wires would stab them in the cheeks and they had raw tissue here and in the front and they'd have to wear wax a lot.
Yeah, so discomfort, right?
Yeah.
Yeah, no pain, right? Any other good ones?
They could take it out for a business meeting or some high profile moment where it's just 30 minutes or an hour or something, and if they needed to.
Yeah, and I have a lot of patients that I'll do Invisalign on because they're getting married, right? I just had a patient, she went to Greece and got married. So I get her as far as I can before the wedding, and then I'll take off her attachments, whiten her teeth, manicure it. She goes to Greece and gets married, comes back, and then I just pick up with the treatment. Would that be easy to do with braces? Did someone say food restrictions?
Oh, yeah.
So no food restrictions, right?
Will coffee stain them or something, or not? I don't.
Well, you take the aligners out to drink wine or coffee. But food restrictions with braces and wires and brackets is a significant thing. I mean, you go eating caramel with wires and brackets and you're going to see Dr. Pope on a Sunday morning and they're putting them back on.
He's not going on Sunday.
And if the wire pops up, can you just leave it?
He'll tell you his brackets don't pop off there.
That's true.
All right, so I think we covered pretty much.
By themselves.
We pretty much covered most all of this stuff. While you guys were out on break, Doc was asking me this question about external resorption. And just so you know, we've never had a case, out of 7 million cases, we've never had a case of external resorption using aligner therapy. Why is that? We don't put enough force.
Slow.
Yeah, it's a slow, gentle force. You cannot get, you couldn't try to get this with aligners.
Wouldn't your tray just crack before it was?
You just can't, yeah, it's just impossible. To get external resorption like that, you would have to be cranking with such a strong acute force to get it to happen. You just can't do it
You
with
wouldn't be able to get
aligners.
the tray in.
Yeah.
I'm sure you get the direct smile clip.
Smile Direct Clip, yeah.
Or, yeah.
You guys want to talk about that in case you get a patient that
Yes.
comes in to see you and they go,
Well, you guys have ownership in Smile Direct, right?
no, we don't
Oh,
anymore.
okay.
We did, but we don't.
Oh.
But they're causing reabsorption, right? It's a new thing now because they're shifting the teeth so fast.
No, they're not shifting teeth any faster than we are. The difference that what Smile Direct Club is doing is that they're not doing any vetting of their patients, meaning that, let's say you had an implant on number 10, and you had crowding on your upper front teeth, and you did Smile Direct Club treatment. They don't know that you have an implant on 10. There's no way they know. They don't take x-rays, they don't see a doctor. They can do it off of a scan, but a scan doesn't show if you have an implant or not. It's everything above the tissue, right? Or let's say you had perio. Let's say you had a bunch of perio with hardly any bone support on your lower anteriors, and you had crowding and you did Smile Direct Club, and you took your aligner out and your teeth were inside it.
Oh.
You ever see that ad on Instagram where someone like did Smile Direct Club and the laterals and the thing? So what's the difference if a patient comes to see you?
Invisalign made the ad? No, I'm just kidding.
No. But if a patient is in your chair and they're like, I want to fix my, my crowding in the front, why shouldn't I do Smile Direct Club? It's like, a lot less expensive than Invisalign. And I would say, well, how do you even know how much Invisalign is? Have we gone that far yet? And just tell them that, we have a product that matches Smile Direct Club in terms of price and length and number of aligners and everything. We have the same product at the same price point. The difference is we have doctors overseeing the treatment and doing the treatment. We're not doing teledentistry. We're not like letting people just send people their aligners to their house and trying to move implants in perio-evolved cases, right? So we're responsible about it. And to be honest with you, they're getting their ass sued by American Orthodontic Association, California Dental Board, all kinds of state boards. They're gonna have to comply because they're moving teeth recklessly. Their patients are not being vetted for perio. They're not being vetted to see if they have implants. It's just ludicrous, right? But what's the problem? Why are they successful?
Because people don't have to go in either.
Yeah, because you have to realize you're competing with consumers, not dental patients. So dental patients understand the value of you guys being doctors and hygienists and overseeing their care, right? But if you don't go to the dentist and you're just a consumer and you just want to straighten your teeth and you don't know any better, you see the price isn't that expensive, you see it on Instagram, and like, why wouldn't you do it, right? But their IPO came out yesterday and it was down 25%. Smile Direct Club. And also know that, you know, Invisalign has been in existence for 22 years and 7 million cases. The value of Invisalign is about $18 billion. The value of like Delta Airlines is like 35 billion. That's how big Invisalign is. So you're dealing with a company that has very deep pockets, that just does tons of research on all their materials. If you ask Doc here, she's been doing this 11 years, ask her how many new attachments and how much new stuff is always showing up, right?
It's a totally different ballgame now.
Yeah, it's always changing. They're always coming up with better attachments and better material and better software and better staging and better customer service and better speakers now. Okay, so these are the advantages, you guys, of this. So when you're talking to your hygiene patients and you're just cleaning their teeth and they're saying, oh yeah, I'm thinking about doing Invisalign. Why would I do Invisalign instead of braces? Now you guys have some stuff you can talk about, right? And doctors too. Now you see the clear advantages over it, right? I'm not going to spend a lot of time on this. I am going to zip through it quick because I think it's a fascinating thing, and Dr. Pope will get mad if I talk about iTero too much. Right, Doc?
No, I'm not reading that. It's fine, dude.
No, you can have my candy. So I gave this lecture. I'm just showing you a few slides. I gave this lecture at the Bellagio Theater, our Invisalign Summit last year. And they asked me to talk about digitalization in dentistry, which I think is a cool topic. Because really, when you look at dentistry now versus when I started doing dentistry, I was joking with him in New Mexico, like I got a computer in my dental office in 1984 when no one had computers in their offices. My brother's a dentist older than me. He's like, what are you getting a computer for your dental office? That's like so stupid. I'm like going, dude, it's cool. I can do what can I do with it? I don't know what I can do with it, but it's cool. So I got a computer in '84, and then, you know, we had, anybody old enough here that you had chemically dipped x-rays? Yeah, you know.
Well, I work for a dentist.
In dental school, yeah.